Hi, everyone. My name is Nell Conway from First Draft's events team. Thank you so much for joining us on our Reporting on Coronavirus webinar series. First Draft's mission is to empower societies with accurate information and critical moments. We help reporters around the world produce credible content. Without further ado, I would like to welcome our U.S. Director, Claire Wardle.
Thank you, Nell. And I'm just going to say I'm really excited about this webinar because I love discussing ethics. I really wish that we had a big open conversation in a room to discuss this, but as many of you know, the challenge of Zoom bombing means that we have to run webinars like this. But my hope is that this will be a very interactive webinar. We're going to have polls, we're going to have lots of time for questions. But I'm here today with Victoria Kwan, who is First Draft Standards and Ethics Editor and thinks very deeply about these things all the time. And we thought it would be great for Victoria and I to co-host this webinar because I do quite a lot of this stuff. And then sometimes I have to ask Victoria if I can do these things. And we have really interesting conversations. So I'll let Victoria describe a little bit about the work she does at First Draft, and then we'll kick off the webinar.
Hi, everyone. Welcome. Thank you so much for joining us today. And thank you, Claire, for that lovely introduction. So as you mentioned, I work with Claire on developing our guidance for newsrooms on how they can effectively and credibly cover all sorts of mis and disinformation, but also just, anything having to do with all the challenges that come with being a reporter in a world of information disorder. And in addition to that, I also help ensure that First Draft's own output is in line with what we recommend for newsrooms. So with this whole challenge of the reporting on the pandemic and all of the different kinds of changes that this has brought on journalists, the way journalists report and how we report and where we report, we thought it would be a really great opportunity to talk about some of these new issues or variations on old issues that have come up.
Great. So for those of you who don't know, we're First Draft. We've been around about 5 years. And we essentially help newsrooms navigate these challenges. And so in order to advise and to support, we actually do some of this work ourselves. We have journalists around the world who are monitoring different types of misinformation in different spaces. And so we wanted to talk a little bit about the conversations that we have internally about the work that we do. And the reason we do it is because we can't really advise if we don't do it ourselves. So on our site, firstdraftnews.org, we have lots of training resources, different things you can find, including a reporter resource hub. So hopefully many of the things we discussed today, you can find extra information about that. And so in today's webinar, we basically wanted to go over 3 different topics. The first one is covering closed spaces and messaging apps. So we'll kick off the webinar with that. I'm going to hand over to Victoria to talk a little bit about how to cover the people who are talking about this on social media. When we use their stories, we use their content, what are the ethical challenges associated with that? And then we're going to finish this webinar with a topic that I have to admit, as somebody who's been studying this for a decade, the level of conspiracy theories that are now circulating around coronavirus is unprecedented. And it's leading to a number of new challenges for reporters about how to cover these conspiracies in a way that doesn't give them more oxygen. How do you do this that we're not necessarily diminishing the people who believe these conspiracy theories? So it's going to be a very meaty third section of the webinar, I promise, when we get to conspiracy theories. So let's kick off with this question about covering closed spaces and messaging apps. So probably most of you know that Mark Zuckerberg last year gave a speech and he talked about the pivot to privacy. And really what he was referring to was the fact that Facebook was going to put more emphasis on closed spaces, particularly Facebook groups. But that's partly because he had seen what was happening globally, which is for a decade, we all talked about what we had for breakfast. We almost shared too much information. And as people started to realize that by sharing some of that information, it might impact their job prospects, their insurance claims, we've seen people kind of move into smaller spaces with people that they can trust, people that they know, or people that believe similar things to them. So we've seen quite a big shift, I would say, in the last 2 years, which is that a lot of misinformation is now in spaces that are much harder to monitor. Many academics monitor Twitter because it's easy and open. That's not the case with some of the spaces we're going to talk about today. So I think we've got a poll that we have set up. And we're really interested, have you used closed groups or messaging apps as part of your coronavirus reporting? So it might be Nextdoor, which is a community space that you have to have kind of a postcode to be part of. It could be a Facebook group, or it could be WhatsApp or another closed messaging app. But we would love you, we're going to give you 10 seconds to either click yes or no, because we're really interested to know how many of you have actually been doing this in your reporting.
As the results come in, it looks like we're almost a 50-50 split. We have 55% say yes and 45% say no.
Great, that's really interesting. Okay, so I think we have another poll for those of you who said yes. Which closed spaces have you used? Because we talk a lot about WhatsApp, but there's actually a number of different messaging apps that are very popular in different parts of the world. I think that is a different poll now. Do we have one that's...
Yes, we're live, and you can select all that apply. So let us know. We'd love to hear. It's not just a one selection, or if other. As the answers are coming in, it's a pretty close tie between private Facebook groups and WhatsApp. WeChat following behind, and then Telegram. 25% say other, and 0%, no one has done Kakao Talk, Line, or Viber.
Yeah,
Wait,
I think
so for those of
more regional, right? Like Line, my understanding is that Line is a very commonly used in a Taiwanese or like Taiwanese American communities, like a Kakao Talk for like Korean communities. So yeah, there that just might mean that for today's participants that, you know, we don't have anyone using those very specific ones, but it sounds like Facebook and WhatsApp are definitely the most popular ones.
Yeah, before I end the poll, I'll say WhatsApp came in at 77% with our highest, most used closed space. We can go on from here.
and I've just seen the comment about Line is big in Thailand. That's when I realized how important Line was, when I met with a fact checker from Thailand who said, yeah, we do almost all of our work online. And I was like, oh, tell me about Line. So I think Telegram is really interesting. It's very popular in Iran, but we're actually seeing it grow in popularity in other places. So certain countries, for example, Myanmar uses Viber to a very high number. So actually, if you on the poll ticked other, I'd love if in the chat you could say what those other messaging apps are that you use, because it's really important for us to stay on top of all of these different things. So this is actually the most up-to-date data we could find, which unfortunately is from July of last year, but you can see how many messaging apps are very, very popular, particularly when you compare them with things like Facebook and YouTube, which are the top two most popular globally. But then look at WhatsApp, look at Facebook Messenger, look at WeChat. So they are very high. And then if you get further down, we just talked about Viber and Discord, which is a popular gaming platform where people actually communicate in different guilds to talk about gaming. But it has also become a platform that some people congregate in. We have seen evidence of congregating to coordinate disinformation campaigns. So each of these platforms are very different, but we're going to talk about different ways to think about these platforms, not just the technology, but how to navigate these platforms because of their culture and how people use them. So if you could go to the next slide. So the really interesting thing about WhatsApp is that it has been discussed at length about its role in places like India and Brazil, but often in places like the US or Western Europe, there was a sense of like, nobody uses WhatsApp. I mean, Spain very early on really took to WhatsApp, but it hasn't necessarily been seen in other countries as much until coronavirus, where there has been a sudden recognition that WhatsApp is a really big player. And it's particularly the case for communities of color and communities who are worried about surveillance. And so we see those kind of communities deliberately wanting to be in these spaces, many of which are encrypted. So it's impossible for WhatsApp to know what's circulating on WhatsApp in the same way as it's impossible for me to know what's circulating on WhatsApp. We'll get to that in more detail, but that's why they have become more popular. Also, they're incredibly easy to use. The reason that Facebook purchased WhatsApp back in 2014, maybe, somebody needs to real-time fact check me. But the reason that they purchased WhatsApp was because they knew that there were huge swathes of the population that didn't have an email address. But almost everybody, or many people, have a mobile phone number. So by purchasing WhatsApp, they could essentially get people into the Facebook ecosystem who weren't going to have an email address because they kind of leapfrogged straight onto mobile phones. So that's why they're so popular, but that also means they're very simple to use. And diaspora communities, where you've got families spread out around the world, are using WhatsApp because they can connect easily to one another. So it's a phenomenon. Huge number of people use WhatsApp, but for that reason, it is increasingly becoming a place where we're finding misinformation spreading. So there are a number of things to consider when we are thinking about the ethical challenges of reporting from these closed spaces. So I talked about WhatsApp being encrypted. Now, it's encrypted because people are, that encryption is important to these users. Now, if we're thinking about reporting from these spaces, what does it mean if ultimately these people believe that they are in a space that is private? But if you can join that group, you can get access to that information. And as ever with journalism, it's this tension between privacy versus public interest. And so there are many people who are saying, well, with coronavirus, it's important to know what these rumors are so that we can publicly debunk them. And that tension is not an easy one. And we're going to talk about the different ways you can monitor these spaces and what that means when you have to think about public interest versus privacy. Because I think sometimes academics, journalists can sometimes think about public interest. It's like, oh, of course we can justify it. But my worry is sometimes we can take these steps without thinking about what those implications are. And one thing that always is part of conversations to do with digital journalism is just because something is technically public, what do the users themselves feel? So I remember very early on when I was working with the BBC in 2010, a local radio station was taking comments from a public Facebook page about a hospital closing and reading those comments out on air. And somebody sent a really scathing email to the BBC to say, I put that on Facebook. Facebook is private. Why did you read out my comment? And the BBC was like, well, it was on a public page. And she was like, no, Facebook is private. She didn't understand the difference between her newsfeed versus commenting on a public page. And so that's why the ethics of this is difficult, because with WhatsApp, sometimes the moderator of a WhatsApp group will post a short link. Like if you're on WhatsApp and you run a group, maybe it's your family group, in the settings, it will give you a share link that you can share with your uncle. But you can also post that share link onto a website or in a Facebook group to say, you can join my WhatsApp group. So some journalists or academics will say, well, that link is out there. I can just join. What's the problem? And that's that challenge, which is, does everybody in that group know that you're in it? Do they know that you're a journalist? Do they know what you're going to do with that information? And so as ever, the reason ethics is so interesting to talk about is that this is a very gray space. And we need to think very much about how people themselves consider this. So the other thing we need to think about is this difference between transparency and security. So it's very easy for journalists to say, right, or editors actually. Editors will say, if you want to get into a closed space, you need to be transparent about who you are. Well, we have to consider what kind of group that is and what kind of person you are. So if, for example, you are joining a nurses forum, and nurses are discussing their access to personal protective equipment, you might argue, well, that's in the public interest to be in that group. And it's okay to say, hi, I'm Claire, I'm from First Draft, I'm a journalist, I'm really interested to hear your stories. Hope you don't mind. I'd love to talk to you more about what you're finding. That is different from doing an analysis of, for example, a white supremacist group, or let's just talk about it for a second, like child sexual abuse imagery groups. Like, do you want to be in those groups? Be like, hi, I'm Claire from First Draft. You can't do that and be transparent. But also you have to consider your security, because there are some groups where essentially you're going undercover. Are you going to take on a different name? Are you going to say that you're not a journalist? Are you going to take on a persona? So we also have to say, for certain types of journalistic investigations, you have to consider this in the same way as you would consider going undercover. So this challenge of being, yes, of course, wherever possible, be transparent, but also think about your own security. And I have to say, as a woman, as a person of color, it does change things if you are potentially doing this work, particularly some types of stories. So we just have to be, we just have to have honest conversations about, again, these challenges are not easy. And I think one of the purposes of a webinar like this is to say, does your newsroom have a set of editorial guidelines about doing this kind of work? Because most newsrooms haven't updated their guidelines. Victoria has written our guidelines. Many newsrooms are behind the curve on this. And so the things we're talking about today really should be enshrined as part of a newsroom's output or their editorial guidelines. And the other thing quickly to talk about is this question of amplification, which is often things are seeded in closed messaging apps with the hope that then it will grow, move into social media, and then be picked up. So the other thing some people argue is it's in the interests of society to catch these things early and to be in these groups to try and understand what the coordination mechanisms might be and to understand what is planned. Like sometimes in these groups, they'll say at 6 p.m., we're going to try and make this hashtag trend on Twitter. So we have to understand that closed messaging apps are kind of at the beginning of this, what we call the trumpet of amplification, which is it starts in these groups and moves all the way through with the hope that it will be amplified by a BBC or a CNN. So the other thing we have to talk about, we talked about WhatsApp, is places like Facebook groups are increasingly spaces where misinformation spreads. You can have open Facebook groups that you can find in search and you can join without anybody having to let you in. There are Facebook groups that you can find in search, but you have to apply to join. And then there are Facebook groups that you can't find, that they are secret and you only find them if somebody sends you the link. So again, that plays into the ethical challenges of whether or not it's okay just to be in them. And Brandy Zadrozny from NBC has done some of the best work, actually. She spends a lot of time in anti-vax groups on Facebook. She wrote this story, which was a really awful story, where a mother was urged by other members of a Facebook group to give her son Tamiflu and he died. Like that, these kind of, we see other groups that tell mothers to, if their child has got autism, to give them bleach, like really, really awful stuff. And they tend to be in these Facebook groups. Again, if we want to understand what's circulating, we might have to join these groups. But by joining these groups, again, where's this balance between transparency, security, public interest, etc.? So on the next slide, one thing that we say to all of our journalists is, where possible, if you find something in a WhatsApp group, can you see whether it has jumped into other platforms? Because then we have some sense of scale. And this is actually from a WhatsApp group that we saw, and we saw it in WhatsApp, but then we also saw it on other platforms, which made us feel much more comfortable about talking about it. This was actually, it looked like it was circulating in China, but it was actually filmed in Brussels with Mandarin subtitles added on to look like an American soldier was trying to spread this in China. But again, started in a closed messaging app and then it spread. The spreading is actually really important to capture because you actually want evidence that this stuff has moved around. So in terms of ways to monitor this, the easiest way, well, I say easy, but is the one that has the least ethical concerns, is when you basically have a tip line and people send tips to a newsroom. And when you do that, they're giving you consent, they're telling you what they're seeing in WhatsApp. You then might, if you want to do an investigation, call them up and ask for evidence. Like maybe sometimes a reporter has actually done a screen share with somebody to say, can you show me this group? Prove to me that this isn't a screenshot. You know, there are ways that you can do that. The other way is to kind of join these public groups. You can find these short links on the web. But again, I just would really be careful about this idea that they're public. They're not public. It is a way into these groups. And the other way is to essentially, and from that, some organizations kind of scrape, like they computationally scrape all of these different public WhatsApp groups and they bring it into a database. Again, I feel really nervous about that, but it is a way sometimes to see trends. But I would always say that that's essentially a tip that you then have to go and do other reporting around. The other way is to basically befriend communities, get into those groups and be clear about who you are. But all of these require different ethical sign-off. There's a lot of thought that needs to go into it, but there are ways of monitoring, but I wouldn't argue that anybody should monitor without thinking about it. And finally, in this section, and this is new and part of this whole pandemic, is that when everybody is doing everything online, you don't have other types of documents or platforms. So Zoom, we're on Zoom right now. There has been a case where essentially somebody got given a link and they went into a private meeting and then reported on what happened in that private meeting. So that's not quite a Zoom bomb, but is that in the public interest to do that? If you could get hold of a White House Zoom meeting, would it be okay for you to report on that? And that's a joke because you couldn't get access to that, but we have to be careful about the law here. But for example, in the UK, the Computer Misuse Act, I think somebody was telling me today, was back from 1994, was updated in the early 2000s. I mean, it's not fit for purpose. So unfortunately, the legislation we have around this is not clear. And so if you get given a link and you access Zoom, are you breaking the law? And this is not a legal webinar, this is an ethical webinar, but I just have to stress that. I think it's important to know. And Google Docs. Now there's a lot of people working on Google Docs because they need to work together. Not everybody has tight security. Is it okay if you get access to a Google Doc because somebody shared it with you? I'll be honest for a second. Somebody once mistakenly shared me into a huge Google Drive for Google, the company. And I had access to all of their slides. And I had to be like, oh, excuse me, I don't think I should have access to this. But you can get access to all sorts of things that you might not or shouldn't have access to. So again, I just kind of wanted to throw that out before we start the questions, because every day there's a new kind of ethical challenge based on the new world that we live in. So I've talked at you for 20 minutes, I apologize, but any questions about these things, any experiences that you've had? We'd love to hear from you. So
go ahead.
Now.
Oh, we have a couple questions that came in. This one came on earlier on, and I think you covered a lot about, ways to ethically report by cross-referencing platforms. But we did have a question saying that in India, WhatsApp has become a very convenient platform for fake news spread and epidemic about COVID-19. How ethical is it to use this platform for reporting?
Yeah, I mean, I think obviously in a place like India where we have evidence that this kind of misinformation can lead to real world harm, I would argue that there is a public interest to know what's happening. Some Indian fact-checking groups have done an amazing job of setting up tip lines. So people are sending examples. That's always my preference, to have tip lines, because I think it's very clear ethically. But I would argue that if, as a fact checker, I would also keep an eye on a number of these groups if I could get these short links. But that doesn't mean I'm going to report on it. I would use it as a tip, which then I would then go and investigate through other ways.
Great. And then we have, can we apply the general rule of thumb undercover work here? If we can identify ourselves for safety reasons, then we conceal the identities of the perpetrator suspects in the report. If we want to reveal them, then we should identify ourselves and offer a right reply before the report goes out.
Yeah, I think that's absolutely right. I think, as I said earlier, there are lots of parallels here around undercover reporting. And so I think exactly to that point, this idea that you can get into a group, use people's names, report what they're saying without asking for a right to reply is really problematic. And I think in many cases, again, we should see these spaces as tips, potential sources, as a way to kind of springboard more reporting. Because again, people can say things in these spaces thinking that they are completely private. The idea that reporters would be lurking and then just using that for material, I do not think is ethical at all. I think if you are doing undercover reporting around potentially illegal activities, this is when you need your editor, your lawyer. You need to be very, very careful about what you're doing. But I think there are lots of interesting parallels between undercover reporting, which journalists have thought deeply about for a long time. I think we should take those same pretty strict guidelines and apply them to some of the work that we might do in these closed messaging spaces.
And I'd love to address these two questions before we move forward. The first is, did you have an ethical obligation to tell the Google employee you had access to the Google Drive?
Maybe I'm a terrible, well, I don't really call myself a journalist. I'm a researcher by training, but I could not have slept at night if I did that. I mean, I just felt like it was just a mistake. We all send emails to the wrong people, and they had just clearly put Claire in and thought it was another Claire. And so I personally, as an ethical person, felt like I had to tell them. But also I was too scared to click on any of the links, just in case my Claire came up at the top. So maybe I was also just not very brave. Well, because in the story about Zoom, the guy actually left his name up. Right now you can see my name is Claire Wardle. So that person entered the Zoom meeting, it came up with their name, and very quickly they disappeared and then re-entered with a telephone number. But everyone's like, hang on, who's that anonymous telephone number? So that was not a very smart move.
And it's interesting because the next question is about Zoom. And I think to clarify, the question is it legal to record audio during a public meeting held over Zoom? Should journalists announce their intentions before hitting record in that situation?
That is a great, great question. And I think it goes to a number of people who are now having to do their work in new spaces and not thinking about it. So if I was, for example, running a public meeting now, I would have to assume, if I'd sent the link out, that anybody could be on that link and that ultimately a journalist could be on that link. And if it is a public meeting, I would assume that people understood that it's on the record. However, I think we have a number of people right now who don't necessarily understand how links can be shared, or in their head wouldn't think that would happen. So I think we're having some kind of, politicians and counselors having to learn pretty quickly what this new world means. But I would say a little bit like the beginning of this webinar, Nell said, this is being recorded. It will go onto YouTube. We won't use your names. But we have an ethical responsibility to you to say, this is what we're going to do because we're recording this. So I think, again, people are trying to figure out that we need new ethical guidelines, but we also need the public and politicians and others to become more savvy about how we use this technology.
Great. We do have a couple more questions, but let's pass it to Victoria to take us through some more sections, and we'll get to some more questions in a little bit.
Great. Thank you so much, Nell and Claire. Yeah, so these are really great questions, by the way. I would think that for the last question about whether you can record or not, like that might also be something you'd want to run by like the legal department, like at your organization, because I think different countries like might have like different laws around like one-way recording, or maybe that's for phone calls, and I'm not sure how that applies to like Zooms, but you know, as Claire mentioned, this is all like uncharted territory, so you know, it's really important to like figure out like the ethical, like logistical, and like the legal guidelines around all of this. So to talk a little bit more about specifically what we do at First Draft to address these like ethical and like security concerns. So when First Draft staff want to monitor these like closed spaces, like they need to come like talk to, you know, their line manager and also with me, the ethics and standards editor. We try and go through, you know, questions around like, okay, if you have to answer like a entry questions, like to get into these groups, like, are you going to answer honestly? How and when and will you disclose your identity and motivations as a journalist? What are the rules around like interacting with like members of that group? Are we going to put limits on like the time that you're spending in those groups? What are you going to do when you collect your evidence? Like if you take screenshots of what people are like saying or posting in those groups, like are you going to use them like as a tip, or like are you going to blur out the names if we end up like writing about it? And you know, we also have conversations around, you know, how to treat these groups as like genuine communities. Like even if you don't necessarily agree with like what they say, it's important to go into each group knowing that there are, you know, certain guidelines or like rules and like language rhetoric that they use, and to really understand like the dynamics of each space before going into it. For the security precautions, we do recommend that our staff use VPNs and incognito mode when they are monitoring a message boards, a very strong and unique password for each of the platforms that they're monitoring. And you should always use a password manager to remember these never save passwords in browsers. We also encourage our staff to use like professional social media accounts wherever possible, rather than their personal accounts, and to conduct a digital footprint checks. So you can go into incognito mode, try Googling yourselves and see what comes up, and see how open your own social media profile settings are, because you may be surprised at what you are maybe inadvertently revealing to the world. You might not want everyone to know about your location, your email, your check-ins, or other personal information. So as part of the digital safety check, it's important to make sure your settings are locked down. And then here's three other resources that we've found helpful in thinking about our own security guidelines. There's the New York Times How to Dox Yourself on the Internet. So it's a step-by-step guide for how to find and remove information about yourself online. There's a CPJ's Digital Safety Kit, and then there's the DART Center's toolkit for dealing with hate campaigns, and that's for journalists who, you know, unfortunately find themselves the target of a harassment or like doxing campaign. So those are, we will also send an email after this webinar today with links to all of these resources. So if there's any other questions for this section, we can maybe take them now, or we can move on.
Absolutely. From one of our attendees, thank you. This is fascinating. You mentioned about newsroom policies on transparency versus security. Do you have any sense of the extent to which newsrooms in the UK/West do have well-defined policies about their reporters' behaviors on this area?
Well, I think it's a little bit of a mix. I've talked to representatives from newsrooms before that do have like a quite clear policies that are covered in like their ethical guidelines. Sometimes it's a matter of using their existing like ethics code and applying it to like this new circumstance of monitoring in closed groups. Like, for example, the question that was brought up earlier, like using existing guidelines on undercover reporting and then applying them to this new online situation. Other newsrooms, I think, might have written specific guidelines for like a closed group messaging and messaging app monitoring. I haven't seen any like systematic studies across like newsrooms in the UK or newsrooms in the West, like what percentage like has these guidelines and which ones don't. If anyone knows of any research or like studies that have been done into that, I would be extremely interested to look into it. But I've also talked to like reporters who say that no, like my newsroom didn't have like guidelines around this. So I kind of like made it up as I went along and then got permission like from my editor, or talked about it with my editor later, but it was very much more of like a bottom up approach rather than a top down approach. But, honestly, newsrooms and other information providers should be looking at implementing like a top-down approach so that their staff are well protected and have thought about these issues before doing this kind of work.
Great, thank you, Victoria. Let's move on to the next section.
Great, so our next section is about covering those who are affected by COVID-19 or posting about COVID-19. And so as a follow-up to the last section, it's not just closed spaces where you can find interesting coronavirus stories. So open spaces like Twitter or Reddit or public Facebook groups can also provide valuable tips or sources or insights. But even though these spaces are public, there are still some ethical considerations to take into account, particularly when you want to embed or quote or otherwise highlight someone else's content in your reporting, and especially if this person is not a public figure. So pointing readers like towards someone's social media content can provide some like really interesting like color to your story, but it can also have consequences that the person doesn't anticipate. And sometimes the consequences can be good, like they might get added publicity for like a fundraiser they're holding, but sometimes it could also be really negative, like they might get a lot of online abuse or harassment. So it's important to keep in mind the intent of the person who created the post. Sometimes people don't realize that their posts are public, and sometimes they do, but they haven't thought through the potential consequences. So take, for instance, this public Facebook post is from a New York nurse called Diana Torres, and she uploaded a picture of her and her colleagues wearing trash bags at their hospital because the hospital had run out of personal protective equipment. So she, in this post, which is set to public, she used a lot of hashtags and she tagged a lot of news organizations as well. And so, the intent of this poster is to get publicity for what's happening in this hospital. And likewise, on the post on the left, this is from a Twitter user called Mylanette and shows a picture of all the N95 masks that her sister, who works as a nurse, has left. And so she's asking for mask donations and also calling on the government to take action. She's using multiple hashtags. So her intent here is to call attention to a problem that needs to be solved on a collective level. And on the right hand, we have something that tips a little bit more into the public, but starting to feel a little bit private like line. So it's a conversation between two people who are discussing friends and family that they've lost to COVID-19. And though this is public and one of the users is using a hashtag so that anyone who clicks on or searches COVID-19 UK can see her post, this feels a little bit less like a public call to action than the other posts. And then on the flip side, you might have people who may not have ever meant for their post to end up being amplified in the media. As Claire mentioned, there are a lot of people who maybe don't even realize that journalists can search for their posts and find them on Facebook. And unlike the nurses who are seeking attention for extra PPE, these people might not welcome the media attention. So some of you might have seen this example in the news last month. There is a family of a man who had died of coronavirus, and they wanted to live stream his funeral, but then it emerged that this man had made some social media posts that were critical of the lockdown measures in his state before he'd come down with the disease. And so when people found his posts, they started embedding it, reporting on it, making fun of him, and his family ended up getting harassed and threatened as well. So they had to cancel the live stream funerals plans. Here's another example from a widow of a man who had died of a coronavirus in the UK a couple of months ago. The media had used her Facebook post, like memorializing her husband, like quite heavily. But as a result of that, then there were scammers. It opened up the family to people trying to profit like off of like their husband and father's like name and trying to like raise money there. So then his widow had to post another message saying that someone has set up a fake profile. It's not me. Please don't send any money. So in addition to thinking about the intent of the poster, we should think about the impact of your coverage as well. Like what happens when you post about these people or like embed their posts, then what are some of the things that you might want to like warn them about? Nurses, also healthcare workers, especially with all the conspiracy like theories floating around, might also be harassed or like trolled over their posts. So that's also something to consider. And so the 3 tips we would give here are: consider the impact, consider the intent, and where the poster might have expected or not expected their content to appear. And if you are talking to the poster about, using their content, it would be good to explain potential benefits and drawbacks of being amplified to a wider audience. So, any questions on this section?
Not at this time. I'd say let's keep pushing through, get through the next section. And just a reminder, you can input your questions at any time and we'll ask them at the appropriate times.
Perfect.
So let's discuss this topic of covering conspiracy theories, which I wish we didn't have to talk at length about this, but I have to say in the last month, a mixture of the conspiracy that 5G was causing coronavirus, conspiracies around Bill Gates and the idea that everybody's going to be microchipped and that it was actually created in a lab as a bioweapon. And now, unfortunately, this increasing number of anti-vax conspiracies, although I want to talk a little bit about that itself, but the Plandemic documentary that is circulating still on Facebook and other places, which pushes a number of false claims about coronavirus, but also there's a lot of conspiratorial thinking in that documentary, which is you can't trust the government, you can't trust health authorities. Like let's just unpack that, because these ideas are growing in popularity, and we're going to see, I think, some real world impact because of these theories moving from the fringe to the mainstream. So we talk a lot at First Draft about this idea of the tipping point, which is if you go looking for misinformation, you'll always find it, but it doesn't mean that it's right to report on it because you're actually giving it oxygen. All the way through to, actually, if you leave it too late, it's very difficult to discuss that topic because people have really embedded the idea that it's true. And so with this Plandemic documentary, which started circulating last week, I saw a number of newsrooms being like, we're not going to touch this because we don't really want to give it any more oxygen. And then as the week progressed, you saw more and more people sharing it. So reporters were saying, my mom has started sharing it with me. Like my normal high school friends who are quite smart are sharing it with me. What's going on? And so this idea was like, it had like hit this tipping point, which reporters were starting to say, we need to cover this. But how do you cover a conspiracy? And that's what we're going to talk about a little bit now. And so when we think about when to cover, we talk about this idea of these 5 different aspects, which we have used this idea of point. The first one is platforms. Has it jumped platforms? Outlets. Has it been covered in established media outlets? So even if you're trying to be responsible, have other people given it that oxygen? Influencers. Unfortunately, we've seen celebrities and online influencers pushing some of these ideas, and it's very difficult to ignore if you've had celebrities and influencers talking about it who've got very large followings. Look at the share numbers, but so not just comments and likes, but specifically shares. Is this something that's getting a lot of shares? Because that's when you know that it's really moving. And finally, travel. Has the conspiracy theory traveled beyond a niche community? So if it's an anti-vax conspiracy and it's only being circulated in anti-vax spaces, don't touch it. It's when it's traveled out of that community that you need to start worrying about it. So that's the question, like when, but how you cover it is actually a real challenge. So here's an example that has happened during the coronavirus, which is a really, really sad story of Dr. Bing Liu, who was a researcher and was actually researching coronavirus, but died in a murder-suicide. But unfortunately, because he had been working on coronavirus, that connection was made clear in the reporting on his death, which understandable, like that's the story. But unfortunately, that then led to a number of conspiratorial connections, which is, was he killed because he was finding a solution to the coronavirus? Which, you know, I want to put my head in my hands because I can't believe that we live in a world where we have to think about that. But unfortunately, this kind of turned into kind of the basis of a number of different conspiracy theories about this poor man's life and how he died. And again, it's like just thinking about how to word headlines, how to frame a story, because unfortunately now just covering a case like this can end up feeding a number of people who are looking for these kind of conspiracies. So again, it's not saying don't cover it. It's unfortunately just being aware of how these kind of stories can be pulled apart and can be used for certain people's agendas. So that's just one example, but we're seeing, as I've said, a number of them. The 5G conspiracy theory has actually led to telecommunications workers in the UK being beaten up on the street, being spat at. We've had arsonists burning down towers. Like, this has moved from kind of fringe conspiracy spaces online to actual real world harm. And then Bill Gates, unfortunately, has become the central bogeyman. And there's a number of interlocking conspiracies about Bill Gates. But they now are connected to this vaccine piece. And so the challenge we have with the anti-vax commentary right now is we're at least 18 months from a vaccine, maybe 4 years, if ever. And what that means is we've got this huge vacuum of time that is currently being filled with conspiracies about a vaccine, and that it will have been pushed by big pharmaceutical companies or pushed by Bill Gates, or it won't have been tested properly. Now, that's why we need to be careful around language. And I don't think we should be talking about anti-vax. There is an anti-vax movement, but it's a complex movement. There are some people who won't give their child the HPV vaccine, but they will the measles vaccine. So again, we have to be careful about saying people are anti-vax. And the thing with the vaccine around COVID is, I was talking to a doctor the other day who said, if they don't test this vaccine carefully enough over 5 months, I won't take it. And I'm a doctor. I will only take it if it has been tested. So I would argue when we're talking about the way that vaccines are being discussed in these conspiracy spaces is to say, we can't dismiss some of their arguments. And that's hard to accept. It's very easy to like, oh, those guys are crazy. Like, we'll talk about that in a second. We should not be using that derogatory language. What we should be saying is, how do we take some of those arguments around necessary transparency to do with how this vaccine is being created, forcing pharmaceutical companies to ensure that they are being very upfront about what profits they might be making about it. So this, when we think about conspiracies, it's much less about debunking a conspiracy, because it's not an easy fact to debunk. It's often like an interlocking set of narratives pushing some ideas, and the most effective disinformation is that which has a kernel of truth to it. So when you when you do a dive into some of these communities, the reason that people get so persuaded so quickly is because there is some truth to some of the things that they say. Like, we can't argue, oh, the pharmaceutical company don't want to make money. Like, we know there's a problematic healthcare system. So when we think about conspiracies, we have to think about responding to some of those as opposed to ignoring them. So what makes conspiracy theories so attractive is that right now, people are feeling incredibly unsettled and confused and scared. And when humans feel like that, they are looking for self-efficacy. They're looking for a feeling that they can do something. And at the moment, we've taken their jobs away from them. They're at home. They feel like their lives have been turned upside down, and there is nothing for them to feel like they're in control. So these conspiracy theories provide that control. And so, you know, as this slide explains, when people feel powerless and vulnerable, it makes them much more susceptible to conspiracy theories. So rather than dismissing these ideas as crazy, we need to understand why people are susceptible to them and why now. Why is it that we're seeing this huge uptick in conspiracy theory thinking? It's because of this moment in time. And so when you are looking for control, feeling like you know something that nobody else knows is really, really important. And so this idea that the mainstream media is hiding something gives you this efficacy. And one thing I would say is, if you ever look at an About Us page on a media literacy website, it reads identically to an About Us page on a conspiracy theory website. We will give you the tools to investigate the truth. So that's why we have to be careful, because conspiracy theories are given this power and this agency by people in their community saying, investigate this. If you go digging, you will find the answer. And online, you will always find the answer because you will always find information that supports your worldview. So this slide is actually shows this really easy to read 12-page PDF called the Conspiracy Theory Handbook, which has just been published by two very, very established scholars, Stefan Lewandowski and John Cook. And it's really worth, we have the link at the end, really worth reading because it explains why people are susceptible and best practices for covering this. So in terms of what journalists can do to reduce the reach of conspiracy thinking, we've got this little poll. We would love you to think about some of these answers, which is to fact check it, to go after the credibility of the theory's source, to emphasize that the theory is irrational, or to acknowledge the theory can be attractive, or all of the above.
We'll give everyone a minute to answer their questions. So it looks like 54%, ooh, or it's changing. Give everyone a minute. 50-ish% say fact check it. We also have a high vote for go after credibility of the theory source. Quite a few people are saying all of the above. The one coming in the lowest is emphasize that the theory is irrational.
Great, we have some very smart people on the call. So yeah, absolutely. In terms of fact checking it, there's a line here. So for example, I was talking to a newsroom last week who said, should we go kind of scene by scene of the pandemic documentary and debunk each scene? And I was like, oh, no, don't get caught up in that. When there are very clear mistruths, and in that pandemic documentary, there was this idea that the reason that we were being told that we couldn't go onto beaches is because actually the sand was a cure. Like, that is false. Like, so there's a way that you can think about false claims, but in terms of the conspiracy as it is, exactly as we were saying, things like don't dismiss some of the arguments because there are kernels of truth and there's a reason for that. But actually, it's much more successful to explain the why. Like, why are people susceptible? Why might people be pushing this? And to also explain, you know, because people are looking for that self-efficacy, why are they sharing it? So rather than be like, oh God, mum, like, don't share it, you're being an idiot. It's like, hey mum, like, I know these are scary times. Like, I watched that documentary, like, it was polished, like, it looked good, mum. But like, I know we all want answers right now, but why should we believe like those people in that documentary versus like all of these other doctors that are saying all of these other things based on years and years and years and years of evidence? And one of those answers was about the credibility of the source. So the main woman in that pandemic documentary is actually kind of, she was kind of, what's the word? She was a doctor who had her science basically torn apart. She sent something to science and it actually had to be retracted because the methodology wasn't strong enough. So you can actually argue, like, look, yes, she was a doctor, but then look, you know, actually the community recognized that her science wasn't up to scratch. So there's another way there of getting people to understand the credibility of the source. But Victoria's just done a great job of going through slides. I'm like off on my conspiracy land right now, but it's very tempting to use derogatory language, like these people are crazy, insane conspiracies. Unfortunately, that is absolutely not the language that should be used, because it should be about empathy. Because the way that our human brains work is if somebody tells you that you're wrong, rather than be like, oh, thanks for telling me you're wrong, you've actually shamed them in a way that they are more likely to double down on their beliefs because they're embarrassed. And that's unfortunately how shame works, because the information we share online is actually around our identity. We're performing our identity. You perform the identity of an anti-vaxxer or as a flat earther or as a 5G truther. And so when you tell somebody you're wrong, they just double down. So the more we tell people they're crazy, the more that not only do they feel shame, it gives them a reason to dismiss the professional media as not understanding the truth. And if you spend time in anti-vax communities, they will post pictures of themselves with binders of research. And they will say, we are the only people doing the research. Those journalists don't have time to do the research that we have done. They're the ones that are crazy. And so setting us up with that tension is really problematic. And so these examples that Victoria found are ones where really we're explaining the phenomenon rather than repeating the theory. So I just think as societies, we need to have more conversations about why conspiracies are taking off. What is it in society that makes them so appealing? And to talk about the kind of psychological mechanics of conspiracies rather than these people are crazy, that's stupid, let's debunk the stupidity. Like, that is not the way to deal with those things. And so what's the next slide? So finally, we just wanted to give you some of these tips, which is, the first one is consider the tipping point. Just because you can find a conspiracy, is it at the level where you should really be giving it additional oxygen? And I actually wrote a piece for Neiman Reports about the 5G conspiracy and those decisions that newsrooms had to make to say, it's crossed the tipping point, we now have to cover it. Secondly, avoid derogatory language. As we just explained, that's really problematic. And where possible, either in your reporting or with your family and friends, try and use empathy instead. And not in a patronizing way, but in a, we're all in this together. Like, whenever you talk to people, it should be like, I'm seeing this too, mum. Like, I'm also scared. Like, I'd love to talk to you about why this is being shared so widely. Like, what is it that's making this be shared? Word headlines carefully to avoid triggering conspiratorial thinking. I wish we didn't have to write this tip, but unfortunately that's the world we live in now. And where possible, explain why rather than stopping at the what. So Camille Francois talks about the ABCs of disinformation: actors, behaviors, content. Try not to just focus on debunking the content, but talk about the actors and the behaviors. Like, who's pushing that pandemic documentary? Why would they be believing this? You know, are they benefiting? Are they selling health supplements? There's a whole host of ways that we can talk about this that actually talks about the actors and why they're sharing it. So that was a lot of information, but does anybody, do we have some questions now?
We have some comments to get the conversation started. One comment is, conspiracy theory can also be extended to attaching the corona spread to a particular community, region, or culture. And then we have another comment that sometimes it's simply hard to fact check definitively, even if there are lots of indicators otherwise, because we may not be subject matter experts.
That's a great point. There was a really good podcast, the New York Times Daily, last week, that was talking about the conspiracies around the origin of the virus. Because one of the reasons we're seeing all of these conspiracies is because we're lacking that origin story. Like, people can't believe they've been at home for 2 months and they still don't know how this virus started. And in this podcast, they were talking about, in the intelligence community, there's a difference between a mystery and a secret. And a secret is when a government knows something, but they're trying to hide it, versus a mystery, which is they don't know at all. And this podcast was like, is it that China knows how this virus started, but it's trying to keep it a secret? Or is it a mystery for the Chinese government themselves? And that's why we have all of these different conspiracies, but they're not really conspiracies. There are people who are desperate for answers. Did it come from a wet market? Or did it escape from a lab via an animal? Did it escape via a lab because somebody didn't wash their hands properly? Was it a bite? I mean, that's why we have this. And so it's really important to recognize is when you have a vacuum of information, it gets filled with these conspiracies. And so that's a big problem here, is that people want answers. And unfortunately, there aren't answers to give people right now, which is, you know, allowing people to come up with those answers themselves.
Great, so we have just about 5 minutes left. Our final section is, oh, actually, we just had one more question pop in. So before I close this out, there's also the issue that we know constantly shifts and changes as science pieces together that picture. How would you advise dealing with that?
That is a great question, because I would argue that one of the biggest mistakes that health authorities and newsrooms made back in January, February, March, is that we were kind of reporting on the coronavirus as if there was consensus around the coronavirus. And instead, we should have said, this is a crisis. And in a crisis, we only know what we know at any given time, but what we know might change very quickly. And therefore, you need to keep listening to the updates, and you need to recognize that if we give you new advice, it's because we now have more data and more information, not that we lied to you before. So somebody shared with me the tweet that the poor WHO shared on, I think, the 14th of January, that said, there is no evidence of human transmission around coronavirus. That was 5 months ago. The WHO was saying there's no evidence of human transmission. I mean, it's unbelievable how much more we know, but advice about masks, advice about whether or not children are at risk, all of that is changing, and then people are confused. So just to quickly answer your question, I wish that we were more honest with our audiences to say, this is what we know now. The evidence that we're giving you right now is from a preprint. And let me explain to you how preprints work and how science works and how science is about replicating research. to see whether we can find the same findings if we repeat the study. We've just failed, I think, to explain to people how little we know about this virus, and how, you know, as much as people are demanding answers, we can't give them those answers quickly. So I think that I would argue that we're in this for the long haul. I think the guy from the WHO yesterday said we might be living with this forever. So I think we just have to change the way we talk about it with each other and our audiences, so that we can just have a much more nuanced understanding of the complexity of this virus.
Great, thank you, Claire. Victoria, did you want to add anything there?
Now, only to add that I think to follow up on what Claire is saying, I think when newsrooms like publish, you know, the newest information that they have, it would be worth going back to the older articles and like attaching something to the beginning, like saying, you know, this information may now be outdated. Here is like our latest like a live blog on the situation, or here's the latest data we have on this. Just because, you know, we've seen examples even fairly recently before, like very old articles like starting to make their way up, like, you know, on the trending lists again, and that data may already be like completely outdated, like in this pandemic situation, like something from a couple months ago, if it gets reshared again as if it were recent, could be quite like damaging and confusing for people as well, which in turn makes them more susceptible to, you know, conspiratorial thinking. So, you know, all of this is, you know, a lot of added work for newsrooms and journalistics, certainly, but important to keep in mind for keeping your readers as updated and empowered with the accurate information as possible.
Great, so we just have a couple slides left that overview some of the resources we have. Before we go through those, I will let everyone know these will be shared in an email following today's webinar. And we also would love to hear from you. Your feedback is incredibly important to us. I've just put a link into the chat box. You can copy and paste it into your browser for a quick survey. And Victoria, I'll have you close this out.
Great. Well, thank you so much, everyone, for joining us today. So as Nell has mentioned, we will be sending out an email afterwards with the links that we've included in this deck. We'll send you the digital safety resources from the New York Times, from CPJ, and from the DART Center, which are very helpful for like figuring out ways that you and your staff can like protect yourselves as you're, you know, monitoring whether it's closed or like open groups. We'll also send you the conspiracy theory handbook from Lewandowski and Cook, which is 12 pages and very, very easy to read. It's got sections on, you know, how the press can prevent the spread of like conspiracy theories, how to talk to someone who might believe in a conspiracy theory. So it's got some pretty helpful advice in there. And we also want to direct you to our resources for reporters coronavirus hub, which has a lot of handy tools and guides. We're keeping track of like platforms' responses. We have a debunked database, a list of other upcoming webinars, and our favorite coronavirus reads from around the web. In addition, we also have an online course for journalists on covering coronavirus, and a public guide on navigating the infodemic. So please do take a look and share it, use it, and let us know like what you think of all of these resources.
Excellent. So thank you so much for watching. My name is Nell Conway. Thank you to Claire Wardle and Victoria Kwan. Feel free to contact us on Twitter, and for additional resources, please visit firstdraftnews.com/coronavirus. Thank you so much, everyone, and have a great day.